The following is a community affairs presentation from the Ulster County Health Department. This is the Healthy Ulster Radio Show, a weekly presentation exploring community health and sustainability with guests representing a broad spectrum of community partners working to make Ulster County the healthiest in New York State. This program is sponsored by the Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network.
Good morning, and welcome to another edition of Healthy Ulster Radio. I'm your host, Dr. Carol Smith, Ulster County Commissioner of Health and Mental Health. Joining me today is my co-host, Vin Martello.
Good morning, Dr. Smith.
Good morning. Vin is our Director of Community Health Relations. Every week, we speak with guests and experts from a wide variety of organizations and professions that influence the health, vitality, and sustainability of our community. Before we begin today, we'd like to just take a moment to remind everyone listening that the content on this program is for general educational purposes only. If you have questions about your personal health concerns, please speak to your doctor. Today we'll be talking about a subject of great importance to the people of our community, Lyme disease, as well as other diseases that are carried by ticks. Over the years, we have seen hundreds of cases of Lyme disease in the Hudson Valley.
We'd like to welcome our first guest today, Stacy Kraft. Stacy is the Public Health Education Coordinator for the Ulster County Department of Health and our resident tick expert. Stacy will be talking with us about the types of ticks that are found in our area, the diseases that they may carry, and what you can do by way of prevention. So, Stacy, what types of ticks are found in our area? Do they all carry the bacteria or viruses that are harmful to people?
Well, thank you for having me today. There are a number of ticks in Ulster County and the Hudson Valley area that spread tick-borne illnesses. I do a program at the health department, which is tick identification. And over the years, I've seen mainly 3 ticks come into the health department, but geographically speaking, we know from some other surveillance efforts that there are 4 main ticks that we see in this area. Number 1, most common that I'm seeing brought in for tick identification is the black-legged tick, also known as the deer tick. And that tick unfortunately spreads a number of viruses, parasites, and bacteria. The most common disease that we see in Ulster County is Lyme disease, and so in addition, that tick spreads anaplasmosis, babesiosis, Powassan viral encephalitis or deer tick virus, and Borrelia miyamotoi, one of the more emerging tick-borne illnesses. One thing I do want to note is that the deer tick virus is not a very common one in the Hudson Valley, and the CDC has noted only 60 cases in all the United States. But we do want to be aware that that virus is a potential threat, and that we want to understand what to look out for when it comes to signs and symptoms. Additionally, the dog tick is the second most common tick that I'm seeing for tick identification, and this tick can spread Rocky Mountain spotted fever, tick paralysis, and tularemia. These viruses and bacteria and diseases are not very common at all in Ulster County. And then there's the woodchuck tick that I've only seen a few of for the Tick ID program. But this one, it's also known as the groundhog tick, and it spreads the Powassan viral encephalitis. And lastly, we know there are Lone Star ticks in Ulster County, and this one spreads ehrlichiosis.
And what is the mechanism by which ticks might transmit harmful bacteria or viruses? And do they all carry these viruses and bacteria? Well,
actually, it's important to consider that not every tick attachment results in illness, because not every tick has disease-carrying organisms. In addition, if the germs are present, in most cases it takes time for the germs to move from the tick into the host. And the key here is finding the ticks early so that you can prevent tick-borne illnesses. We know that there are documented transmission times, and it is different based on the different illnesses. For the most part, though, for Lyme disease, for instance, if you find the tick before 36 hours of attachment, your risk of the Lyme infection is reduced. When it comes to something like anaplasmosis, we know if removal of the attached tick occurs within 12 hours, your risk of the tick-borne infection is reduced. For ehrlichiosis, if you remove the attached tick within 36 hours, this can reduce the possibility of the infection spreading from the tick into you. For babesiosis, if removal of the attached tick occurs within 24 hours, the risk of tick-borne infection is reduced. And the shortest time frame is with the Powassan viral encephalitis or deer tick virus, where we need to see that tick removed within 15 minutes to reduce the tick-borne infection.
So, Stacey, exactly how does a tick transmit a virus or a bacteria to a person? What's the mechanism? How does that work?
It depends on the illness, but for instance, babesiosis is a red blood cell parasite, and when it attaches, that is when that parasite can transfer from the tick to the person.
And given that ticks are a threat and may carry serious and harmful bacteria and viruses, what can people do to help protect themselves and their families?
Well, some simple steps to reduce your risk would be to wear repellents and make sure you follow label directions carefully. You want to check for ticks frequently. So you can do that while you're outdoors and when you come indoors. Additionally, you can do a very thorough tick check at the end of the day. And showering soon after being outdoors, ideally within 2 hours, has been noted by the CDC as one of the most effective ways. In addition, placing clothes in the dryer on high heat for about 10 minutes can also kill any ticks that may be on them. Ultimately, you want to avoid tick habitat by walking in the center of trails and avoiding vegetation. Ticks live in moist and humid environments, particularly in or near wooded or grassy areas. However, you may come in contact with ticks during outdoor activities around your home or when walking through grass, but especially in vegetation such as tall grass, leaf litter, shrubs, and even on rock walls. So another thing to consider is that protecting your pets from tick-borne diseases can help protect you. And you can look into some preventive measures by speaking with your vet, or the CDC has a nice guide as well.
And you mentioned that there are tick repellents available. Can you briefly describe them and how they work?
So the repellents are basically products that you can use on your skin, and these are registered through the EPA.gov. There is an easy tool to search for registered products that you can basically look and choose a repellent product that's right for you. All you have to do is specify what kind of insects you want to prevent, what kind of protection time you're looking for. You can specify the active ingredient or other product-specific information. And when considering an insect repellent, you want to think about your needed protection if you're looking for against mosquitoes, ticks, or both, and how long you'll be exposed to them.
So, Stacey, what are the names of the most common products out there in terms of repellents?
Oh, sure. You can find some great repellents in places that sell outdoor supply products and pharmacies, that kind of thing. What you want to look for is DEET. That is a chemical that CDC and EPA recommend for application on skin or clothing. Additionally, a more natural plant-based repellent that has proven effectiveness is oil of lemon eucalyptus. And there's many more, but one of my favorites that's just for clothing is called permethrin. And this actually will kill ticks when they come in contact with, say, shoes that you've treated. And the nice thing about it is that it has a long duration of effectiveness. Depending on the product, it could be up to 2 weeks of use for one application.
And generally, for more information on all these subjects, where can people go, say, online to find the best information about prevention?
I think the CDC and New York State Department of Health have the most helpful resources.
Great. Well, thank you, Stacy. You're listening to Healthy Ulster Radio. Today's discussion Thank you, Stacy. You're listening to Healthy Ulster Radio. Today's discussion is about how you can prevent Lyme disease and other tick-borne illnesses and the treatment options that might be available to you. We'll be back after a short break with our next guest, Dr. Mark Tack.
The excitement continues to build. The mission of Health Alliance is now made even stronger by our new partnership with the Westchester Medical Center Health Network. By combining a legacy of community-based care with WMC Health, we are building a stronger, healthier, and more vibrant community. We'll be collaborating to provide preventive, primary, specialty, and advanced care right here where you live, where we all live. Health Alliance and WMC Health, advancing care here. Visit hahv.org to learn more.
Welcome back to Healthy Ulster Radio. I am your host, Dr. Carol Smith, Commissioner of Health and Mental Health for Ulster County. Before we get started, I'd like to once again remind our listeners that the content provided on this program is for general educational purposes only. If you have questions or concerns about your personal health issues, please consult your own physician. In this segment, we are continuing our discussion about how you can prevent Lyme disease and other tick-borne illnesses, and the treatment options which are available to you. Our guest is Dr. Mark Tack. Dr. Tack is an infectious disease specialist with an active practice in Ulster County who is an expert in tick-borne illnesses. Dr. Tack also donates his time to serve on the Ulster County Board of Health. Dr. Tack is a greatly respected member of the medical community in Ulster, and it is my great pleasure to welcome my friend and colleague to our show. Good morning, Dr. Tack.
Good morning. Thank you for having me on your show today.
Dr. Tack, if a patient comes to see you about an actual or suspected tick bite, what are the signs and symptoms that you look for? And what are some of the questions that you might ask the patient?
Well, Carol, we try to identify patients who may be at risk for Lyme disease or other tick-borne illnesses by taking a thorough history. There's really two different types of patients we encounter. The first type of patient is someone who comes in acutely ill, someone who may have been exposed to a tick bite within the past several weeks and is worried that they're currently sick. In that scenario, we're asking about their immediate symptoms: fevers, chills, sweats, muscle aches, headaches, and any other complaint that the patient may have. That group of patients, we're trying to separate out a tick-borne illness from other types of viral infections or other diseases that people walking into a doctor's office may experience. Another group of patients, the second group we see in a referral practice, is people who think they've had Lyme disease or other tick-borne illnesses for a period of time. In that scenario, we're taking a history about what their potential risk for exposure was. Do they remember being bitten by a tick, when that exposure may have occurred, what happened afterwards, and then what they're experiencing coming into the office, whether they're having headaches, forgetfulness, word searching, whether they have numbness, dropping things. There's a host of different symptoms that we're questioning the patient about depending upon their risk and what their complaints are.
Is there any classic sign or symptom, say that once you see it, you can, in your mind, make a clinical diagnosis?
Sure, absolutely, Carol. When patients come into the office in the endemic season, particularly now in summertime, when we see somebody who has an ECM rash, it stands for erythema chronicum migrans. is an expanding rash. It's a circular or oval rash. It doesn't always look like a bullseye. We always like it when the patient reads the book and comes in with a bullseye, but it's frequently not that case. But the hallmark of a rash from a Lyme disease case is it gets bigger and bigger day after day. A patient comes in and says, I've been bitten by a tick, and there's a little round circle around the bite site. That's not a rash from Lyme disease. That's just a reaction to a tick bite. But when a patient has a 5, 6, 7 centimeter rash that's getting bigger daily, associated with fever, chills, body aches, and just feels like a truck has run over them, that is the classic presentation of early Lyme disease.
Is that rash in the area of the bite, or can it be elsewhere on the body as well?
The vast majority of rashes will be in the region where the bite was, but not all. Some patients will have rashes at distal points in the body, and there are some patients who will have many, many rashes. One of the presentations we see of Lyme disease is something called early disseminated Lyme disease. In those patients, we may see 15, 20, 30, or even 100 different blotchy-looking rashes on the body, and they're often not as big as we would normally expect them to be.
Is the rash always present in a bite, or is it sometimes, or?
In most of the trials where people volunteered and were exposed to tick bites and were confirmed Lyme cases, 90 to 95% of the time, people will get a tick bite. There have been lots of arguments about that number, but one of the problems is the rashes are painless in most patients. And I've had a patient walk into my office scheduled for a routine visit having nothing to do with Lyme disease, and in the process of examining them, found a big, large bullseye rash right in the middle of their back that they didn't even know was there. So many people may not see the rash that occurs when they first acquire Lyme disease.
Mm-hmm. And if a patient, suspects that they may have been bitten, what questions? How do they prepare for the visit with you? What kinds of questions would you hope they would ask or be aware of to help inform you and help make your diagnosis?
Well, certainly the more information they could give us about their risk for tick exposure will help us. If they remember specific bites, I tell people now, everybody has a camera phone. If you see a rash on your body and you think it might be a tick-borne illness or Lyme disease, take a picture, because 3 months from now, when you come back into our office for an opinion because you're having a problem, to be able to go back and see that picture really helps us a tremendous amount.
Dr. Tack, at what point would you do a blood test? And can you tell us a little bit about that type of test? You've been talking about clinical signs that you can see, but if you do suspect and you feel as though you want to get further information, will you send your patient for a test, and how reliable are they?
Right. So Lyme serology testing is a topic, again, of a lot of controversy, but in general, we follow the CDC recommendations. Lyme tests are not meant to be a fishing expedition, so they should not be used as part of an annual physical exam. People should not just go to the doctor and say, can you check my cholesterol, order my mammogram, and do my Lyme test. If a patient comes in with clinical symptoms that may suggest a history of Lyme disease, a bite, a swollen joint, significant fatigue, arthralgias, joints hurt, muscle aches, we would then order laboratory tests. Most of the time we would just order the laboratory tests. We order a test that the standard test by the CDC is a 2-step procedure. The first step is an ELISA, that's ELISA, enzyme-linked immunosorbent assay. And basically, it's a number. The blood is put into a machine. It kicks out a number. If it's below a cut point, the test is negative, and they stop. If the ELISA test is equal to a cut point, where it would be considered indeterminate or positive, the lab will then do what's called a Western blot. The Western blot test actually takes your blood, puts it on a gel plate, exposes electrical currents, and you see bands based on the protein weights of the antibodies your body produces to fight Lyme disease. And we can break those down into early Lyme disease, called IgM tests, and memory IgG tests. You need to have 2 out of 3 IgM bands for the test to be considered positive, or 5 out of 10 IgG bands for the test to be considered positive. The reason that you have this is because there are other bacteria that have similar immune responses, so you may get a band fighting a different bacteria with a similar weight as one that fights Lyme disease. Typically, our Lyme patients have 8, 9, or 10 out of 10 bands and 3 out of 3 for early cases. The tests are usually markedly positive when the index of suspicion is very high, when you think the patient is going to have Lyme disease.
Now, we heard in the first part of the show that there are other diseases that are carried by ticks as well. We have ehrlichiosis, anaplasmosis, babesiosis, the Powassan virus, Rocky Mountain spotted fever. So there are a number of other diseases that we know to be carried by ticks. How often do you see some of these other diseases at this point in your practice?
Well, the second most common tick-borne illness we see after Lyme disease is anaplasmosis. Anaplasmosis and Lyme disease share many things in common besides being transmitted by a tick. The abrupt fever, headaches, body aches, and chills are very similar, although our experience is that patients with anaplasma and ehrlichia tend to feel sicker. Though it's a relatively easy diagnosis to make because these patients have a classic abnormality in their lab testing. Their white blood cell count is typically low, their platelet count is typically low, and their liver enzymes are typically elevated. And so just by ordering a simple CBC and metabolic panel, we'll immediately see the abnormal labs, and it makes the diagnosis very simple. We often send off DNA testing for confirmation, but we immediately treat the patient just based on the abnormal lab findings in the appropriate season. We've been seeing more and more cases of babesiosis over the past several years, mostly starting in southern Dutchess County and slowly working its way into Ulster County and north. Babesiosis, again, is a different disease. It's similar to malaria in that the parasite infects red blood cells. Patients with babesia tend to complain of fevers, chills, headaches. It tends to be a more prolonged illness, and they also have typical abnormal lab findings. Many of them are anemic and have low platelet counts. We now have a situation where all of the local hospitals are able to identify the parasite in the bloodstream when requested within an hour. So if you come to an emergency room or to a doctor's office, we can have a blood smear done and identify the babesia parasite very quickly.
And generally speaking, if you've confirmed a Lyme disease diagnosis or one of the other diseases you've mentioned, what happens next? What are the treatment options out there? Well,
there are different treatments for different diseases. Lyme disease is generally treated with 1 of 3 antibiotics. Amoxicillin would be the one option, doxycycline, another antibiotic, and a third antibiotic, cefuroxymacetyl. These are all 3 generic antibiotics available very reasonably with different side effects and different profiles. Amoxicillin is the first choice in children. Doxycycline is usually the first choice in adults. Anaplasmosis and ehrlichiosis are treated with doxycycline only. Mm-hmm. It is the first and really only antibiotic used. Babesia is a little more challenging. It's treated with a combination of medications called atavacone and azithromycin. Mm-hmm. So one is an antiparasitic agent, one is an antibiotic. Mm-hmm. And those antibiotics are available in the community. Babesia medications tend to be a little more pricey than the other medications. If you're bit by a tick and it's a high-risk season and that you think that tick has been on you for more than 24 hours, then you should contact your physician immediately. The Westchester Medical Center group led a study several years ago where they used a single dose of doxycycline, 200 milligrams, one time, and that was able to prevent any cases of Lyme disease from developing.
Mm-hmm. And is the treatment with antibiotics, is that a one-shot deal, and does that usually knock it out most of the time, or do patients have to come back for repeated visits and treatments?
That's an excellent question. The studies compellingly demonstrate that one course of antibiotics for Lyme disease is adequate in almost all patients. The only time we find ourselves using a second course is if the patient has neurolyme, Lyme disease that involves the central nervous system, or refractory arthritis, where a large joint is filled with fluid and doesn't get better with oral therapy. In that scenario, we use intravenous antibiotic therapy, usually for 21 to 28 days. I do not treat patients with second, third, and fourth courses, and multiple studies have been done over and over again that demonstrate no clinical benefit to prolonged or multiple courses of antibiotic therapy.
I think that's just about all the time we have for today, for today's program. If you'd like to contact us for more information, send an email message to healthyulsterradio@gmail.com for more information that you can use to help keep your family and your community healthy and strong. Please tune in next week for Healthy Ulster Radio. Thank you, Dr. Tack.
Thank you.
Thank you.
Dr. Smith, our wonderful commissioner, Stacy Kraft, our wonderful public health educator. See you next week.
You've been listening to the Healthy Ulster Radio Show, a community affairs presentation from the Ulster County Health Department, sponsored by Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network. Thanks for listening, and be sure to join us for another edition of the Healthy Ulster Radio Show next week.